few things before you even start. Read your care of plan. See how much your patient is able to do by himself or by herself, and ask them which part they want to do. If they can do it, let them do it. Use a basin and a washcloth. Check the temperature. It should be approximately 115 degrees. The easiest way to check is, since you're having your gloves, is dip your elbow into the water. If it's comfortable for you, don't feel like that's okay. Always ask the patient or your client. You're gonna start with your client's face. You don't want to put soap on their face. You'll go always from the in to the out, okay? You're gonna wipe down his eyes and then the forehead and everything else pertaining to the face, going down to the neck. Now from here on, you can add some soap. Try the mild soap if it's possible, not the one with very strong perfumes. It irritates the skin and it can cause all sorts of issues. You're gonna wash with the soap. You're gonna clean it up with a different towel. If it's possible to have one more basin with clean water to rinse off any extra soap, that would be great. And then you make sure you dry every little part. You dry. Another important part is to give your client as much privacy as you can, okay? Just uncover one body part at a time. You're not just washing your client, you're also assessing their skin, because you're gonna be the first one to discover if your client has any skin issues, okay? When you get down to the feet, make sure that you go in between the toes, you wash it, you rinse it, and you dry it. Check your client's heels. At this point, you're gonna change your water. You do not want to wash your client's privates with the water that you just washed their feet, okay? And you wash their front part, okay? You dry it. Most of your clients that are able to do this, they'll wanna do this themselves. So let them do it, okay? Once you're done with the front, then you can ask them to turn to their side, and you'll use the same technique. Bend one knee, that's towards you, and then you turn them to the side. If they can stay by themselves, that's perfectly fine. If you need to hold them or you need an extra cushion to hold their body weight, then you're just gonna use one hand to gently wash their back, dry it out, okay? If you see breakdown, make sure you don't rub it. You gently tap it, and again, report it to your supervisor so they can take measures and don't let that skin deteriorate further.